Welcome, everyone. We are here on Wednesday, March 18th, 2020, for a special called meeting of the Coppell City Council. There is a quorum present, even though you can't see them. So I'm going to call the meeting to order. Put that first. So I do want to mention that we are demonstrating and practicing social distancing. So you will see that a couple of us up here at the dais, and we have some people in the audience, but all of the council members are here and present. So the first item on our list is citizens' appearance. And I understand we have one person who has signed up to speak, and that is Mr. Walker. Would you like to come forward, please?
Where do you want me to stand?
You can stand right there by the...
Behind the podium?
Behind the podium. Well, right there. Right there is fine. And please state your name and address for the record.
Jim Walker, 400 Hawk Court, Coppell, Texas. Mayor, members of the council. I'd like to take a moment to address the way this community has responded to the crisis caused by the COVID-19 virus. We haven't experienced anything like this in our lifetimes. We're confronted with an enemy that cannot be seen, it cannot be heard. It affects us randomly, whether we are directly affected with the illness or we learn our family, friends, and coworkers are suffering. It seems that this enemy has suddenly ripped away so much of our social fabric. Meeting friends over lunch at J-Max or a cup of coffee at George or Zen Zero. Cheering for our high school athletes. Attending worship services. Going to the various meetings held every month by our local service organizations. How easy it would be for us to vent the fear, frustration, and anger we are experiencing towards each other. How easy it would be to turn inward and elevate our selfish interests over those of our larger community. But that is not what has happened. Not in Coppell, not in our community. We've seen neighbors checking on neighbors, people reaching out to elderly folks on their block or down the street to see if they need anything, people offering to pick up groceries or prescriptions for their friends and neighbors. So many people escaping the confines of their homes to walk their dog, waving at their neighbors as they walk by, enjoying a quick conversation. People leaving larger than normal tips for our hourly workers at restaurants when they were still open. Countless appeals on social media to help our neighbors and to support our local businesses that have worked so hard to contribute to our quality of life over so many years. What we've accomplished together as a community has been impressive. We've built many public facilities and amenities that our citizens enjoy day to day. But in the end, these are only a material expression of who we are as a community. As we've confronted this invisible and silent threat that preys on the most vulnerable among us, we have seen our community respond with a spirit that elevates love over fear, persistence over surrender. As Paul once wrote those in another community called Corinth, we are hard-pressed on every side, but not crushed, perplexed, but not in despair, struck down, but not destroyed. We've seen the beautiful spirit of this community come alive in its response to this crisis. As Churchill once said, we make a living by what we get, but we make a life by what we give. We know we have what it takes to beat this threat as long as we continue to lift each other up and to help each other get through this as friends and as neighbors. And I, for one, am proud to live in a community of so many wonderful, caring people. Thank you.
Thank you. No one else has signed up to speak? I haven't seen the list, so I'm hearing none. So our first item for consideration is consider a resolution extending the mayoral declaration of a state of emergency as a result of the COVID-19 virus and providing for the interim public safety measures and providing an effective date and authorizing the mayor to sign. We have a number of things that we would like to do, so I'm going to turn this over to Mike Land to orchestrate.
Thank you, Mayor. This evening, What we're going to have is our city attorney, Bob Hager, is going to talk through and use this as an opportunity just to educate us all on what the declaration is, the declaration process, roles and responsibilities, how the process works going forward, the amendment process. Just to give you an example, the judge issued another declaration this afternoon at about 4 o'clock. And so this evening we're having to adjust, and Bob's going to talk a little bit about that. But then the opportunity for council and the mayor for future amendments and possible rescission of the declaration. When Bob is through, then we are going to do a presentation for those in the audience. And in that presentation, we're going to have Police Chief Danny Barton, Fire Chief Kevin Richardson, our medical director, Dr. Malone, who is here this evening, the Superintendent Brad Hunt, and myself, just kind of walk through where we've been, what we're going through right now, and what the future holds for us in the next, say, 30, 60 days, and possibly even longer. Then after that, the council will be asked to kind of return, if you will, to their seats and the opportunity to sit in the seats that we'll be sitting in. I know it's a little different tonight. We're going to learn to see how this process goes. Planning and Zoning is holding a meeting tomorrow night, and we'll see how that process goes, and we'll combine all that information as we prepare for next Tuesday night for our regularly scheduled council meeting. So there's no way to practice social distancing up here if we're all up here together. One of the things that I've noticed when people do presentations and they're shoulder to shoulder talking about social distancing, that's a little bit of an awkward presentation. So we wanted to demonstrate this is kind of really what it's supposed to look like, and it's not an easy thing to do. It's something you have to be committed to and looking forward to making sure you practice. So with that, Mayor, I'd like to turn it over to Bob and have him just kind of go through the declaration process, if you will.
Thank you, City Manager. Members of the City Council. Section, or actually Chapter 418 of the Texas Government Code governs emergency operations for cities as well as for the state and county government. Under those provisions of the state law, you've obviously seen Governor Abbott issue certain emergency declarations. We have also dealt with the county judge issuing those declarations. And in keeping with what both the state and the county have done, the mayor of the city of Coppell. Under the provisions of the 418 of the government code, the mayor is given the statutory authority to declare a state of emergency or state of disaster depending on circumstances. We're familiar with these mostly when we see national or what I call acts of nature, such as things as tornadoes, very bad hailstorms, and those kind of things which cause local damage. The thing that's so miraculous in trying to respond to this is everybody in the whole state's affected. So it's very difficult. The mayor, in making the declaration, and the county, given their declaration, if there's a conflict between the county's declaration and the city's declaration, the county or the more stringent requirements would apply. There are things in some of our communities that they have that we don't have, and there's things that we have that other cities don't have, where people congregate. For example, a city I represent has a bowling alley. Well, that's something we don't have here, but we have other facilities that are here that need to be addressed where there's social gatherings. So there is some variation from city to city. Countywide, we've tried to cover, Judge Jenkins has tried to cover as many of those uses as possible. And the one that was most recently singled out is restaurants, bars, taverns, gymnasiums, museums, and the like. So the mayor is given that authority. The mayor's authority is only good for 7 days. After 7 days, the council shall come together and make a decision on what they want to continue as the rules and regulations going forward regarding this emergency that we're in now with the COVID-19. So what you have, we've prepared the resolution to continue the restrictions that have been placed by the county judge and the mayor to continue for a 30-day period. The council is given the authority under state law to set the period for the restrictions to govern what we do going forward regarding the crisis we're in now. Obviously, you can shorten it or lengthen it as you deem appropriate. You can come back and rescind it if things improve over the next few weeks, and we don't need to practice social distancing like we do now, based on the modeling that's done by the medical professions and the epidemiologists. That doesn't seem likely, but we can always hope for the best. So what you have is the resolution. The resolution is authorized under state law. What we need you to do is weigh in tonight and discuss this and determine what you want the rules going forward based on what we have and where we find ourselves now. Thank you.
Bob, just to be clear on something, the resolution states April 24th. Our last council meeting in April is the 28th, so it should say the 28th.
28th,
correct? Okay.
yeah.
Just want to make sure.
Yes, that is correct, and there may be typos because I've been doing these for not only you but for 30 other cities in the region. So I apologize for that. So we'll get those picked out. If there's changes you want to make, I have this in Word, and our city secretary has it, and we'll get those made tonight and get it signed.
Great, thank you. Mayor, if we could then just step to the stools below the dais.
Is there assigned seating?
Is there a sign sheet?
Yes, there is.
Okay.
Mayor, let's see. Yes.
Am I up there?
No. You're here. You're there.
Here?
Yes. You don't need that, right? No. Brad, you're here. All right. Dr. Malone, if you'll come back to the mayor, and then Kevin, and then Danny.
So who gets this?
Whoever would like to grab it first.
Okay. Are we there yet? What do you see on the monitor, Mark? I mean, Mayor Pro Tem? Just so you can see me? Okay. So, initially, what I would like to do is to talk a little bit about the actual responsibility of the mayor and council. In this situation, the city is responsible for the safety and welfare of its citizens. So it is our responsibility to look at the things that are a public threat. And what I have experienced over the last 2 weeks and more since Thursday is I have seen a very unusual situation that I have never seen before. I'm sure there are people that have seen it, but I have not. It is an incredible coordination from the federal to the state to the county to the cities. And there are, I can't even tell you how many conference calls there are a day because I'm not a part of any of them. But I know that I have, or all of them, I have been a part of maybe 20 since last Thursday. And like today alone, there were 3. Monday, there were 4. And it is a combination of the federal government wanting to let everybody know at one time. So there were 3,000 people on that call. And so it was everybody from governors to city council, mayors, And it was very interesting that they were lining it out for everyone. Today, on that same call, Vice President Pence was on there thanking everybody for taking action. Because what we are doing now is we have an opportunity. And they've said this really in almost every single call, that we have the opportunity, and I'm going to read it, to significantly reduce the spread of this virus over the next weeks and months. I want to let you know right now, you are going to see the numbers increase. That there are more tests out there, and as those tests are more and more available to people, you are going to see more and more positives. But at the same token, that means that a lot more people will be tested that may not be positive. These first rounds of tests have been primarily people who were at risk and had symptoms. So there were more positives than not. We have had, over the last several days and the last weeks, we have had more and more and more of the tests, private companies being able to do the tests as well. And Dr. Malone might get into some of these a little bit more in detail. But I can tell you that everything that is being done to stop the spread. Today, the order from the judge follows along what the CDC guidelines are telling us to do. And that is really where all of these changes are coming from. The change today to go from not only community, changing or canceling community, to canceling social gatherings, means that people are gathering in homes because they can't gather at church. It is still an issue. If you bring people into your home, you're still having the opportunity to spread. So pay attention. Do what you can to protect yourself and the people that are around you. And all I can do is tell you that we will be here to do everything that we can to protect. And we have people here to tell us more about what's going on. But first I want to tell you that right now we've closed our public facilities, basically the core, the Cosby Library, Life Safety Park, the Biodiversity Center, Wagon Wheel Tennis Center, the Senior and Community Center, all off-site summer camp sessions, and all summer pool sessions. Those are two new ones that I hadn't seen, so I was looking for verification here. And all of this is, again, like you heard Mr. Hager talk about, is we're planning ahead, and if things get better, then we can always rescind. But we want to get everybody prepared and get them thinking about the future. So what I would like to do at this time is introduce Dr. Malone and see what she has to add to the conversation.
Thank you very much, Mayor. Can everyone hear me? Yep. I'm always nervous with microphones, so please forgive me. I'm going to be talking from my slides, so please forgive me if I look at the screen. I want to accurately tell you what I worked a little while to put together for you to try to make sense of this thing. The first thing I think everyone needs to see with regard to that slide's telling you about the symptoms. We all know that already, right? It's fever, cough, and shortness of breath. And we've known that pretty much from the beginning. What we didn't know is the 2 to 14 days past exposure emergence of those things. This is really the root of why President Trump and all of our CDC leaders have said not just 50 people or 40 people in a room, but 10 people in a room, because we are being exposed long before we know of that person's risk factors. We don't know where they've traveled. We don't know what we've walked through, what surfaces we have touched. And so, yes, we can see the symptoms, but by the time we see the symptoms, they have already been places that we may not be able to accurately track. Thank you very much. Now, because we can't track these patients, and because initially we didn't have a test to see what kind of virus this was. We knew it was a virus. We knew it was a coronavirus. We know it emerged from bats into the human population, very much like the other SARS virus a number of years ago. So this is a SARS-CoV-2 virus. That's the actual viral infection particle. The disease is called COVID-19. So as you can see, in early January, we had a few little testing areas, but we didn't know what we were dealing with yet. There was information being shared. What extent was being shared and the timeline of that. It's at a level above my speaking group. But by the time we realized there was a problem, we started testing for it. Once the testing began, look at the rise of that curve. So it's the rise of that curve, and at the end of that curve, I'm sorry you can't read it, but if you look at those last data points, those words actually say, this was from March 15th. There are positives coming back that we will not know for another 2 to 5 days. So this is the ramp up, the sudden ramp up of the number of patients that are going to need help. In our next slide, this is probably the most important slide I'm going to talk about, because this is the only way to protect our healthcare system. You see the dotted line across the slide there, just about a third of the way up. That is our capacity. So if you took every hospital all across our city, and we're so close to other cities, if you just took all of Dallas County, put all those hospitals in a group together, if we keep exposing people at this level, we will overrun our hospitals. We'll overrun EMS. We will overrun urgent cares. We will not be able to stop the spread of this. So what we're urging, this is why we went from 40 to 10. It's because every person, you guys remember 6 degrees of separation? Oh, okay. Well, you remember how crazy it was, right? The construction worker found a ballerina. Okay, that's what this is. So what we want to do is flatten that curve. We're going to do that by convincing people it is to protect themselves and their family, children, grandchildren. They won't stop assembling in groups together unless they truly understand why we want them to do that. It's because if we don't flatten this curve, we're going to overwhelm our system. That will be a disaster, a real disaster. On our next slide, what can we do? This sounds really, I was going to say ridiculous, but it sounds not very calming or convincing. We want a pill. We want an elixir. We want something to take to make this go away. But there isn't one. What you got to do is wash your hands. Wash your hands. Not rinse, right? Scrub between your fingers, your fingernails, put them in your palm, clean underneath your fingernails. Do that every 3 hours. And if you do that, and you convince your family to do that, and you can convince your children and your neighbors that that is the single most effective thing we can do to stop the progression of 6 degrees of separation. That's what this is really all about. Then, don't touch your face. How many times do we touch our faces in a day? I can't even calculate it. So I've worked on that. Still kind of make some mistakes when I'm running around at home, but when I'm out, I am not touching my face. Cover your cough. If you don't have a tissue, put your cough into your elbow and try to cover that cough and capture those particles, those virons. And finally, we've got to disinfect surfaces. There was a very concerning paper that was published or was sent in for publication to JAMA, and to GEMS, and the journal. Excuse me. Let me just skip that for a moment. There was an interesting paper that really noted that the SARS-CoV-2 virus would live on a stainless steel surface for more than 8 to 9 hours. And it will live on a plastic surface for nearly 24 hours. And there was a very disturbing comment about if someone coughed in the air, that the cloud of particulate could hang for 3 hours. Now that's why we don't want to gather together. That's why we want to try to bring some separation. And that's what our mission as a city is. It's for us to communicate not fear but power. This is not about fear, but it's about protecting ourselves and taking care of each other. And I think several things here that you can do. First of all, you can consult your primary care physician. Many of them are already doing telehealth medicine. There are also nurse lines that can be called. There's Teledoc. You can do that online very easily. Texas has had for a number of years the 211texas.org website, and if you actually go to that website, you can find information on almost anything, but there are entire sections devoted to COVID-19. So lots of calming questions that can be answered, lots of information about where can I get food, where am I going to take care of my children, how do I do this, and various different things. Obviously, the end-all and be-all of information, all of us in medicine, we are following the CDC. So if you go to cdc.gov/COVID-19, you will get information there. Also texashealth.org and, of course, Dallas County. All of our cases that are identified are being tracked by Dallas County. So even though we might take care of a patient with the fire department that eventually is diagnosed with that, we will not get that information until the outcome is known. It comes back to the health department, and that's how that information finally feeds back. So I just want to say, please try to describe to all of our young people, because we've said in many areas it's a disease that is hurting the elderly more. And now what we're seeing is that's not true. One of my services transported a 16-year-old that is now in ICU. So we've got to get this message out that the young people can be hurt as well. And when we make it their desire to stay safe, then we're going to have some success with that. Any questions for me?
Do we want to go over some of the commonly asked questions?
Yes, ma'am, we can do that if you'd like to do that.
Some of the commonly asked questions is, if you have the common flu, can you still test positive for COVID-19?
Yes, ma'am. There are two separate organisms that cause COVID-19 is caused by a totally different virus, and the answer is yes. What they've been doing is checking people for the flu first for two reasons. One is if it's a simple flu, we know how to take care of that. The second is initially we did not have enough test kits, right? Because all the testing was coming, all those kits were coming out of the CDC. There just wasn't enough material. We were working with something we've never seen before. So as we have developed the information for what those kits need to be looking for on the molecular level, on the particle level, now we're seeing other labs coming online. So we now have other laboratories that can perform those tests I just completely lost, like LabCorp. Help me, Chief. What's another one? Quest, thank you. So there are other labs coming online. Parkland Hospital's doing something very novel. They have an outdoor testing line that's by appointment only, and it is specifically for healthcare workers. So it's back to what I said about blunting that curve, flattening that curve. If we can't keep our people from being sick, we're not going to have anybody take care of everyone else. So that specific testing site is meant for healthcare workers, and again, by appointment only. The old Verizon Theater in Grand Prairie, I know that they have some testing opportunities there. I didn't have time to get that information for you, but that's something that you can look into.
Well, and the Judge Jenkins indicated that there are 2 new locations that are coming online, and so we will make sure that that information gets out as well. Okay, can a mosquito transmit COVID-19?
Oh, man.
Is it safe to be outside?
Well, if you are outside in your own front yard, right, your front yard's probably 100 by 100 feet at least, right? So you're really probably pretty safe there. You're safe in your own backyard. If somebody's having a party outdoors and you're downwind, I wouldn't do that.
Thank you. Once you've had COVID-19, can you get it again?
We have no idea. This is a brand new virus, and coming into the human population. Still, very, very much we do not know, and we don't have an answer.
And what is the tracking or tracing process for patients for exposure and possible transmission?
So what happens is the testing goes to the lab and will come back to whatever entity has the patient at that time, like my teenager that I told you about. That's going to go back to the hospital. Eventually, that information will get back to the local health department from which the patient came. And then finally, as EMS, we will be able to get information about whether we actually transported a COVID-19 patient or not. So you can see there's quite a time delay.
Are there minimum alcohol percentages needed for cleaning products?
Yes, there are. It's like 60 to 90%. I want you to be very, very, very fastidious with this information. Alcohol, isopropyl alcohol in a 90% concentration, 1 teaspoonful can kill a child. 3 teaspoonfuls can kill an adult. So, yes, it will work. Treat it just as if it is a poison, because that's what it is, right? So handle it very carefully. But yes, you can use 60 to 90% isopropyl alcohol with care.
And if those types of cleaning products are not available, can soap and water be used to clean surfaces?
Absolutely. I think the most effective thing is for us to clean surfaces with soap and water on a regular basis, right? It's something that we don't do all the time, and we don't always do it in our own homes. But especially if a family does have a patient under investigation living with them, then it's their responsibility, the family's responsibility, to really, really try to keep that home as clean as possible in order to prevent that spread.
What resources are available for those who cannot leave their home and need things?
The 211 website, did that picture already come up, Chief? Did you?
It's on there now.
So this is what the screenshot looks like for 211 Texas. And before telling you that this would work, I tested it. So I called 211. And this lovely female voice on the other end said, "This is so-and-so in the Permian Basin." And I thought, wow, the Permian Basin. So I asked her, if I have people that are not able to get out to get food, is that something you can help with? And she said, why, yes, it is. Let me get more information. About that time, I got a 911 call from one of my services, and I had to hang up. But a real person answered the phone with real answers. So either dial 211 with a specific question or utilize 211texas.org. And it is really, really, you can see the left drop-down box there, those are all, and that's a scroll-up screen. So there are many, many, many pre-identified concepts that you can, or questions that you can look through. And over on the right side, there is COVID guidance. So 211 Texas is quite a very effective tool for everybody to reach out 24/7, 365. If you're, instead of worrying, just get on 211 Texas and ask the question. Someone will have an answer at least close to what you need.
Thank you very much.
You're very welcome.
All this information is very much appreciated. I did. I just skipped it. Yes.
There's whites right here.
So next we will hear from Kevin Richardson, who is our chief of emergency operations, fire department, all of that together. So, Chief, what do you have to share today?
Well, good evening. Yes, my name is Kevin Richardson. I serve as the fire chief here in the city of Coppell. And I'd like to start off by first saying that the city has responded to this incident in a very aggressive, a very professional, and a very effective manner. And so I want to explain a little bit on how, what's going on behind the scenes to manage this situation. The Division of Emergency Management here in the city of Coppell falls within the responsibility of the fire department. People think fire rescue EMS. Yes, that's what we do. But we also manage all hazards. And when I talk about all hazards approach, that would include things like hazardous materials incident, a mass casualty incident, tornadoes, other natural disasters, other man-made disasters, social unrest, transportation incidents, and also in this case, a pandemic. And the way we do that through our emergency management division is we function under 4 phases. The first phase would be prevention, followed by preparation, response, and recovery. And I want to spend a little bit of time and explain what's going on in each one of those phases. So from a preparation phase, the city has been preparing for many years for this type of incident. We have adopted plans, and I want to explain to you a couple of those. We actually have 2. They're very detailed in nature. They're credentialed. They've been practiced. They've been drilled. They've been trained. The entire city organization has had tabletop exercises. We've had actual drills, and we've actually implemented similar plans for other pandemics, as Dr. Malone had mentioned, H1N1, Ebola, and some of the others that we had in recent years. So the first plan I want to talk about is what we call COOP, stands for Continuity of Operations Plan. Basically, what that plan is designed to do is to maintain government. How is government going to maintain ourselves? It's not dealing with the incident, it's dealing with government. How are we going to maintain our essential services, water, public safety, supplies, financing? How are we going to maintain government? And so that plan has been activated. The other plan that we have activated right now is the Emergency Management Plan. And the Emergency Management Plan deals with the actual emergency itself. And so, as I mentioned earlier, all hazard type incidents that we have, there is a specific annex for that plan on how we deal with pandemics. And so we have activated that plan and use it as a guide to where we are today. These plans are not just fire and public safety related. They are holistic, meaning that every city department is involved in what's going on. They all have specific roles and responsibilities. They have a go kit where they have to respond to the Emergency Operations Center and fulfill certain levels for us to manage the incident. The reality is we have been monitoring the situation for many, many months. Dr. Malone, who serves as our medical control director for our emergency medical services, your slide showed the last several months, but this has been going on for many, many months. Our emergency management staff has been actively preparing and involved on a daily basis. We get situational reports, we get data, we are participating in conference calls at many levels. So at the local levels, of course, we have two counties that in our jurisdiction, Dallas and Denton County both. They both have emergency Office of Emergency Management departments, and they both have Health and Human Services. And so we're participating with them. At the state level, the Texas Department of Emergency Management and the State Health Services are both two agencies that we're deeply involved with as far as getting guidelines and giving us structure to make sure that we're following the rules that are in place. Then, of course, even at the federal level between FEMA and the CDC, obviously they give us a lot of guidelines. But what that means is that the city has to participate at a national level, meaning that the National Incident Management System has been activated. And so it's very, very structured in the documents that we have to go by, the structure of the incident and how we manage it. And so what we have done is we have escalated to the point of activating our Emergency Operations Center, which is held at Life Safety Park. So we have 4 phases. Level 4 is our normal operating. It's a day-to-day situation. 3 means that we have heightened awareness, and we've been at a level 3 for several months. We have heightened awareness. We have breakout sessions and whiteboards and duties and assignments and all the stuff that's in the planning phase. And then beginning on Monday, we activated to a level 2, which means that we have staffed since Monday 20 incident management positions on 12-hour rotation between the hours of 8 a.m. and 8 p.m. And these people serve as incident commanders, planning folks, logistics, finance, and public safety. So between all those people and their support teams, those 4 departments are down every day trying to manage this incident for the city. And what works is every morning at 8 a.m., the incident commander goes down a list of operational objectives that we have identified for the operational period. We communicate that to our staff. At 3 p.m., we reconvene everybody through conference call and see what has been accomplished and what hasn't been accomplished. And then we do it again for the next morning. And so that's going to be our process as we continue to monitor the incident and to take care of the safety and welfare of our community. Again, from a response perspective, the Dr. Sharon Malone, I didn't have a chance to introduce you. She serves with a group of physicians that provide medical control direction in the emergency medical services throughout North Texas. She's been assigned to the city of Coppell for many, many years. We're very familiar with her and what she does. She has developed a protocol, a very aggressive protocol for our paramedics that have to go in the field and treat these patients with any type of a communicable disease. So although this type of communicable disease may be new to us, responding to communicable diseases is not. It is very similar in nature. So our paramedics are very well trained. They're very well versed. They have all the tools and equipment to take care of what they need to do. That includes our patient assessment, the treatment protocols, how they transport, their personal protective equipment, our decontamination procedures, just to list a few. And those are some of the things that our folks in the field are actively doing in preparation for things to escalate. So in summary, I would just like to say this, that this is a historical situation, that we're going to continue to make adjustments and decisions every day. It's an evolving situation. It's going to continue to change. But rest assured that our mission is to provide the safety, health, welfare, and security of our city. And that's what we're going to do. And we're going to continue to do it until we don't need to do it. And so we're going to make the adjustments at the Emergency Operations Center. We'll ramp up or ramp down depending on what happens. We'll make some quick decisions to make sure that the health and safety and security of our community is our utmost importance at all times. And I would just like to publicly say that the staff that's been involved, the entire organization has just been phenomenal in what they've been able to step up to the plate and take care of. And I don't expect anything less than that to continue. And so as the community, as a nation, as we all step off into some of these uncharted waters, I feel very comfortable that we're going to resolve the situation and turn right around and do the post-incident reviews and try to figure out what else we need to do for the next time.
Kevin, if you don't mind, why don't you describe for our community, you talked about the response, what they should expect if they make a call to 911 so that they're not surprised what our paramedics are going to do when they get to that home or that business.
Certainly. So the question is, what can the public expect to if they call 911? Well, first of all, if they call 911 for any reason, we're coming. And they can expect a highly trained, motivated, and ready crew ready to go to work and take care of whatever it is they need to. The way the system is set up now, if there is a known case, our dispatchers are notified. And that is put into the call notes of the queue. So the crews who are responding will get a heads-up notice that they're walking into a known situation. Our protocol for that is a little bit different. We want to limit exposure to the paramedics that are involved. So not all the paramedics will enter the residence. They will make initial contact to do a recon, determine the true assessment. Some of their personal protective equipment might be a little bit over the normal situation because it is a communicable disease. So they'll be donning on some of their more aggressive personal protective equipment, and then they'll treat the patient as if, depending on the situation. There may even be an indication where the patient is not transported. I think the emergency rooms right now are if the patient is not life-threatening, they want them to self-isolate in place. And they utilize the communications with our physicians to help determine that. But if it requires transport, we're prepared to make the transport. On the receiving end, the hospitals are doing a lot of different stuff now. They're assessing our paramedics, or they're assessing anybody that enters the hospital. They'll meet our paramedics on the ramp, the Sally Port is what they call it, to try to eliminate them from going into the facility. They want to limit contact inside the facility, just from shoes or whatever it is. But if they do, then they do assessments on the paramedics before they enter the facility. Then they do assessments right there to determine what part of the hospital do they want to have a potential exposure to. And so the hospitals are going through this very controlled environment as we speak.
Thank you very much. As you can tell, there's a lot of things going on, and we also have Chief Barton from the police department to tell us a little bit about what's going on from his perspective.
Thank you, Mayor. Is this on? I think I say that every time. I'm Chief Danny Barton with the police department, and I want to echo what's been said in here. From a police perspective, I can tell you that the city is absolutely handling this with a lot of grace. We haven't had any concerns on we haven't had any calls that have concerned us going forward as far as at grocery stores and things like that. I'll touch on that here in a minute, but our call volume's a little bit less than it has been. I think people are just staying home. If you've driven I-35 at 8 o'clock in the morning, it seems like a Sunday out there, but people are doing the right thing, and they're staying home, and they're staying as safe as they can. I will say that what we have done at the police department is we are increasing our visibility. We have beefed up some of the patrol shifts. We are going to be out there, and we will be as close to help as you need us to be. We have rolled back proactive enforcement because we want to minimize the exposure that our officers are having. That doesn't mean that we won't enforce the law. We will enforce the law. And like Kevin said, we will respond to all calls. Now, those responses may be a little bit different than what you're used to. You may get a phone call from the patrolman that's responding. If he can handle something over the phone, if it's just a question, he may go with that route. They may call you on the phone and have you step outside of your house so that they can talk to you in an open air and keep their distance from you. So we're playing that on a call by call because, no two calls are the same. So we're going to come to every call. We're not ruling out anything. It's call to call. when Kevin was talking about the dispatchers, we've just started a series of questions that the callers are going to be asked. And if you call for the police officer and they ask you some questions that you don't think really relate to why you're calling the police, it's because our officers are also on heightened alert and they don't know what they're walking into. And so these questions that you're going to be asked, it helps our officers on how they're going to respond to that call. And so just be patient with them. Just answer the questions, and everything will be great. As we know, there's a lot of shortages in the supermarkets, and who'd ever thought that Amazon would run out of anything? But we know right now everybody's behaving, but fear of the unknown and time sometimes are not good friends. And so just be patient with one another. They'll restock those shelves, and everybody's going to be taken care of. If there are things that you have to have and you just can't get them, there are lots of resources out there. The 211, Metro Crest Services, Woven Health Clinic. We have several resources on our city website as well. So just go there if you need something. I'm almost certain there is a resource out there to get it for you. Other than that, I think I'm forgetting one thing. Maybe I'm not. So other than that, just remember that, the anxiety and the fears and sometimes the frustration that we're all in this together. And what you're going through and what your neighbor's going through is what everybody in the United States is going through. So just be patient. We're going to get through this together. And, like the citizen said earlier, it's up to all of us to do our part, and we'll be fine. We're gonna get through this.
Thank you, Chief. And also tonight, as you all know, we have a great partnership with the city and the school district, and we are very lucky today to also have Superintendent Brad Hunt with us to give us an update as to what is going on with the school district. Thank you for joining us tonight.
Thank you for including me, Mayor. As Mayor Hunt said, I'm Brad Hunt, Superintendent for Coppell ISD, and I want to begin by assuring our parents and community that we continue to focus on the needs of our kids as we remember our core values of great teaching, relationships, redefining success, and engagement. And our commitment to the community is to continue to engage with our community, even though we are closed, to make certain that people know what's going on. We've really beefed up our communication. We are in the process of beginning our online learning experiences for our students. We are very grateful to our community. Over the years, they've supported us with several bond elections that have allowed us to purchase iPads and laptops for our kids. And so that's really helping us to ensure that that educational experience can continue. What we don't want to have is there to be an educational lag for our kids, knowing that they are certainly wanting to make certain that they are doing well academically as we look at pre-K through 12th graders. And so that's been a little bit of a challenge this week as we've been preparing for that. But like Chief Richardson said, we have had emergency plans in place in Coppell ISD for something along these lines for years. We never thought it would get to this point that we were closing school for as long as we have been closed, or we will be closed. Right now, we're officially closed through April the 3rd, but we are reevaluating that every week. And so just as the city is taking its cues from outside agencies, both state and federal, we are as well. I'm in daily phone conferences with our Commissioner of Education, Commissioner Morath. He has been great to give us some guidance and updates, but as it's evolving for the city, it's still evolving for the school district. And so therefore we make some decisions that we know we're going to have to change or possibly make adjustments to. But we believe in educating the whole child in CISD, so we're continuing to focus on that academic piece, but also with the whole child, we recognize the social and emotional piece as well as physical well-being. And so we have been able to provide meals to our students daily. There's 4 locations around Coppell ISD. There's Austin Elementary, Town Center Elementary, Wilson Elementary, and in the southern part of our district, Valley Ranch Elementary School. And we've had about 250 or so. Yesterday we had close to 300, and then I think 320 today. So that definitely indicates to us there's a need for our families to have those meals provided. We have plenty of food right now, so thank you to the community that's been reaching out to me. We live in a community that likes to roll up their sleeves and say, Brad, what can I do to help? We have plenty of food right now. That may change in the future, but we also have planned for feeding all of our students as if we were in school. So we have an abundance of food right now that we need to use before it goes bad. So we're good with food. So again, thank you to people that have reached out. If that changes, we will let you know. We've also been very fortunate to work very closely with the city as well as additional services. Chief Barton has been great as we have had some things that we've had to pass out to our families. Today we passed out devices to our elementary age learners, and so to have some police presence there as we had a very structured process because, as the doctor said, also we are practicing social distancing. Our schools are closed, but as such, we do still have essential staff that are working on site. Most people are working remotely, but the schools themselves are closed. All of our facilities are closed. And so people have asked me, well, Brad, does that mean that I can come out and play on the playground or send my kids to the playground? Right now we're saying no. So we're saying no because of social distancing, but also we're not cleaning the outside of the buildings, the equipment out there, because we're really just focusing on the buildings themselves. So we also have no way to police that if there are more than 10 people there. So we're asking people not to come to the playgrounds. We've closed our athletic areas as well, asking people not to walk on the tracks. We are really promoting that social distancing piece, as you mentioned at the beginning. We know all the tips that have been shared with us in the CDC, but we are also sometimes getting responses from our families. Hey, can our kids get together and have a play date? Or can a group of our juniors get together and work on these assignments as a whole? Our recommendation is no. You'll be able to work on things independently. You'll be able to connect with others remotely. We are wanting people to stay home and practice the social distancing piece, only because we know we have lots of kids. We have lots of opportunities for exposure, and we want to make sure that our kids are safe and our staff are safe. And so with that, that's been part of our planning, part of our communication piece. We do have a board meeting scheduled for Monday, the 23rd. We're looking at changing the time. Right now it's posted it'll be posted at 7, but we're going to try to have it a little bit earlier, only because, again, we're trying to adhere to the social distancing. And there are some things that our board members were being asked for them to do to please take action on some of the resolutions and things that we need there. So just some of the tips that we've been doing as a school district, but again, want to offer reassurances that education will continue. It won't look the way that it would normally look, but it is going to be of high caliber. We have exceptional educators. Our teachers have been working very hard. Again, we've been preparing for something along these lines, not knowing it was going to get to this magnitude. So we thankfully have some structures and things in place to help with that online learning piece. Amazing staff that's willing to help out wherever is needed. And again, thanking the community for just giving us some grace and understanding as we work through all this together.
Brad, is there the most frequently asked question that you would like everybody to know the answer to?
That school is closed right now through April the 3rd. And I say that not in joking, but seriously, we are closed through April the 3rd, and closed means everything is closed. So again, please don't come out to the playgrounds. Please don't come out to use the facilities. We've canceled a lot of events. We're being very sensitive to the other spring events that maybe have yet to be canceled or is yet to be determined. We're trying to postpone as much as we can, knowing that the spring is a very busy time and a fun time for our kids. And so we want we want the school to end on its most positive note as possible. But there are some things that we will not be able to replicate as we would normally like to see them. So some events we know have been canceled. Others are under review. Please check our website for that information. Also, like I said, the meal prep, we are good with meal prep. We have a very sanitized system that we follow. And so ask for people to want to volunteer to help in that regard would jeopardize that in some way. So we're not needing help there, nor are we needing any food. We have plenty of food right now. Those are things that we get asked a lot, and we're taking it on a really day-by-day basis. If we are going to need to extend beyond April the 3rd, we will let the community know as soon as possible. But we're also, reevaluating every day to determine where we are and where we think we might be in the future.
Well, one of the things that I have learned over the last several weeks is what used to be week to week, and then it was day to day, and then it was like every 12 hours, and now it seems like it's about every 4 hours. So if you think you have missed an update, you probably have. So don't hesitate to go to the websites and see if there are updates, because more than likely there are. And now we'd like to hear from our city manager, Mike Land, about general city
things that are going on.
Yes, the city is still working.
Yeah, it's 24/7, constant. And to reiterate what's been said, again, I think it's just really important for everybody to hear that the community has been responding extremely positive to the things that have been happening and the changes that are going on. No one likes change, but if there's ever a time that we have to be flexible and agile, now's the time. The mayor was just talking about every 4 hours. We get calls in the morning about this is what we're thinking about, and we get calls in the afternoon, this is what we're doing. And so we have to be prepared, which makes it a little bit tough as far as getting the information out to the public. And there are times that sometimes these press releases are sent out before we have an opportunity to get prepared for that, just through the simple timing. So you will find there will be times that there will be a lag of information on our part, but we do have a web page. I'll show that a little bit later. If you haven't gone to it yet, it is extensive as far as the amount of information that we have. Mayor, I just wanted to go back on some of the comments you made earlier, just to reiterate again. Our public facilities basically are closed. When I say closed, meaning to public access. The city of Coppell is still up and running. The operations are up and running. From a employee standpoint, we are basically working in partnership, meaning that we're identifying where we could have rotation so that we don't have key people that if they were to get sick, then that function stops. We can't afford that to happen. Our citizens can't afford that to happen. And, I want to speak specifically to Kevin and Danny in the public safety realm. If you can imagine the uncertainty of how this thing spreads and what Dr. Malone said, you can't have your public safety folks wiped out. And so it's really important when we talk about that curve. You keep hearing us talking about flattening the curve, and we don't say that because we can't remember it. It's because it's just so important to the process of what we're trying to do. So it's not just about the healthcare facility. It's about how we provide healthcare services through our paramedics and everything. So anyway, I just wanted to reiterate, the core is closed to the public access, as well as the library, biodiversity center, senior and community center, wagon wheel, and life safety park. Municipal court dockets have been suspended through in trials and hearings through May the 8th. We have canceled city-sponsored events for the spring, to your point, Brad. Earth Fest, Old Town Anniversary, Food Truck Frenzy, and the Coppell Arts Center grand opening, which was scheduled for May 14th through the 16th. Just to put that in perspective a little bit, because I know that's really important for all of us. I was mentioning to Councilmember Roden, we were notified today that our contractor has a subcontractor who may be diagnosed. If that's the case, that construction site could be negatively impacted in terms of what's going on. So even if we didn't have this situation, we may have been caught through that process. So what's important about that is the next portion when we talked about canceled summer programs. The off-site summer camp sessions are being canceled, and the summer outdoor pool sessions being canceled. And the reason being is because if you think about the way the city operates and the way we do hiring, we are in the process of hiring for the summer right now. And so with the uncertainty of what the curve may turn out to be, it would not be appropriate for us to go through the hiring process and then maybe have a season and maybe not have a season. especially when President Trump mentioned the other day, I guess 2 days ago, that this could be July, August, right? And so the problem is it's the unknown for how long this could go on. And so we have to plan accordingly, meaning we had to make decisions today that may impact this summer. Therefore, we're having to make those decisions. So that's why the first time that you saw it was tonight, because those were decisions being made. Now, our outdoor parks and recreation facilities and our park trails, to answer your question, Dr. Malone, that talked about being outside, yes, they are still available. To Brad's point, he talked about cleaning. So the playgrounds. There's really no way for us to keep the playgrounds clean. When I'm talking about if you're doing the slides and those kinds of things. So it really is your best judgment, but we are not able to go out there and steam clean and those on any kind of basis that would make a difference. Just quite frankly, if you want to say that we've been blessed with all the rain that we've had, so that's kind of worked to our advantage a little bit. The one about the county election, or the city council election, we're going to be talking about that a little bit more tonight when we go back to our spots, because the governor did make a decision today that the city councils have an opportunity, should they choose, to suspend, if you will, the election date, which would be May the 2nd, I believe, in the early voting, and possibly move that to another date. The reason I say another date is because I think that's something that's going to be talked about, possibly, maybe not. I'm not sure. I'm looking. I can't see behind me. But the November election date, right? Do what, Bob? Okay. All right. So the November election date. But that's something that the council makes a decision on, and we'll talk about that. And Crystal's going to give an update at that.
I'd like to jump in on that too and say that we also had a school board election, or have a school board election coming up, because we do have one of our places that's up for election. There's an opponent. We too will be making a similar decision, or our board will, making an adjustment on that date, and certainly want to work closely with the city at whatever the city does, since we oftentimes share the expenses on that. But I appreciate you bringing that up, because that question has come up as well.
Right. So from an infrastructure standpoint, when I mentioned to you that the city will continue to operate, the water will flow, and so will the sewage. So none of that gets affected, right, in terms of what's going on. As far as utility billing, we do have policies in place if people do find themselves to be struggling. If you just contact the city, give us a call and let us know, and arrangements can be made. Atmos does have a policy in place. They've done a press release on that, so I'm not going to speak for Atmos, but they've created a policy for handling them. Your respective energy companies, you need to call them directly. We don't have any say or influence on how the energy companies handle their payments and how they deal with that. Just know from the city's perspective that we're doing our best to encourage you to use either online payments, Dropbox at City Hall, bank drafts. You can do all that to make your payments to the city without having to come to City Hall. I will tell you that our traffic in City Hall is greatly reduced. And so Barbara's missing her friends, but she also doesn't want her friends to come around to help keep down the curve. I mentioned to you that the election is going to be something that we talk about tonight. Also, the city is looking at, are there other alternative methods of delivering services during this time? So we're continuing to explore that as well. So modified services is an example. In-home inspections for water heaters, HVAC systems, and those types of things. We are suspending doing any in-home inspections, just so everybody understands. Typically, the work's already completed by the time we come out there to do the inspection, so it's just something that we'll catch up with. We are doing exterior inspections, but all that I'm mentioning is all subject to change as the days change and the rules possibly change that we have to apply. The municipal court window and the Justice Center window are still open at this time. Animal Services has suspended their adoption processes, but they are still accepting drop-offs for the animals. And so, again, much like was said earlier, I just want to make sure everybody understands that we are here. We are here to serve. Our commitment is to you, the citizens of Coppell. And as Kevin mentioned, we have engaged our EOC, our Operations Center, and our daily. There is not a moment, I can tell you, there is not a moment that doesn't go by where we're constantly examining where we are, how are we serving, are there other ways that we can get these services to you, are there questions that we need to get answered. I mentioned to you about our webpage. Oh, sorry, went the wrong way. If you go to our webpage, it has a tremendous amount of information, all the way from how can I help to what are the press releases that are going out. The information, this presentation will be put up on the webpage tomorrow. When I say this presentation, not just the PowerPoint, but this presentation will be put on our webpage as well, and that'll be linked so that everybody can refer to that or send folks who haven't seen it. We wanted to use this evening, while it was simple to come in and say, hey, we're going to make this declaration, we really wanted to use this evening to provide an education to the community about what all the city is doing on behalf of the citizens, how it's impacting us, and what the future could hold for us. And it truly is in a 4-hour increment right now. So, Mayor, I'll turn it back to you.
As you can see, there is a lot of information, and as we discussed, things are changing day by day, hour by hour. As you can also see, this entire group, the city, the school district, everybody is here concentrating and committing to health, safety, and welfare. Those words have been said several times today, and they are in that order for a reason, because health is the most important, and that is where we are concentrating. As was said earlier, we all have to work together to stem the negative effects of this virus, and our community does a great job, and it's an honor to be a part of this community and to see how people are reacting. As said earlier in the citizens' appearance, we are proud to be in this great little city and hope that everybody will do their best to protect themselves and everyone around them. We are shining. We are also affected, so we need to be aware of our surroundings. So right now, I want to thank each and every one of you guys for being here, and we will take a break so we can get to our spots so we can continue this meeting. Thank you. Thank you very much. It doesn't matter. Okay, please have a little bit of patience as we orchestrate where everybody is sitting so that we can assist. And also, I apologize, instead of looking up and down, I'll be looking at my little camera here to see if anybody wants to raise their hand. Okay, so we are resuming at 7:18, and I am going to turn this over to our city attorney, Mr. Hager, and he's going to walk us through the resolution, give us a pending motion. Thank you, Mr. Hager.
All right. Thank you, Mayor. As Chief Richardson earlier alluded to, there is a number of annexes that are adopted as part of the city's emergency management plan, and there's even one of them for me. And as part of that, the mayor then exercises her statutory authority that I alluded to earlier this evening. So as part of that process, a resolution has to be passed to continue the mayoral declaration and order governing emergency measures concerning the coronavirus and how we're responding to it. You have before you a proposed resolution. That resolution continues the mayor's declaration as amended and the order that was amended last week, and also we now have a new order which we would like you to consider, and I will put in the part of the motion that has been adopted by the county judge for Dallas County. The differences in the prior mayoral declaration and order is that there's been a distinction between community gatherings, which stay at 50 people or less, and then we've added recreational gatherings, which have now been dropped to 10 people or less. For clarity's purposes, the new order also has that social gatherings include but are not limited to parties, backyard barbecues, social events, sporting events, and gatherings. Private facilities such as country clubs may still operate their outdoor facilities such as golf or tennis, but must limit those indoor activities such as card rooms and other similar amenities to 10 or less people. As part of the revised order, government buildings have now been added that they're exempt, specifically office buildings, grocery stores and pharmacies, hospital and medical facilities. However, you're supposed to keep your 6-foot distance from one another, and as you've seen tonight, we've tried to practice that going forward. Also, the amendment by Judge Jenkins today, there has been a provision that justice of the peace is to suspend eviction hearings and writs for at least 60 days to prevent people from being displaced in their homes as a result of non-payment of rent. And if some households have tested positive for the coronavirus, that household is ordered to be isolated at home. So what has been referred to as shelter in place would be in effect for families that have a family member that has been tested positive for the coronavirus. And such members of that household cannot go to work, school, or other community functions. So those are the differences. We will make those additions to your order, except as to the justice of the peace, because we don't have jurisdiction, thankfully, over them, and as we go forward. Some of the other things that we have now done as we consider operational issues going forward for the city, that we have not previously addressed in our order or our declaration or the revised order issued by Judge Jenkins is how this would affect procurements that take place for the city, how operationally we implement ordinances that govern the day-to-day operations of our community, as well as what happens with such things as land use planning and plats and other land use regulations where there are state-imposed deadlines. And for that reason, we've addressed those things that since FEMA has been activated as a result of the presidential declaration of an emergency, the Federal Code of Regulations govern FEMA procurements for local governments, and we may make those procurements without having to bid them so that we can quickly acquire the necessary materials and goods that we need to administer to the community needs, and do so without having to comply with our normal procurement practices of bidding or using buy board. So we've added that to the declaration so it's clear to citizens and to our members of our staff that we have that authority. Also, going forward, the city manager may be faced with decisions regarding regulatory ordinances that this council has adopted that govern such things as signage, other zoning regulations that have been imposed upon properties as a result of trying to work around with such things as restaurants and other businesses that are negatively impacted. We would ask that you provide the city manager with the ability to waive enforcement of regulatory ordinances for any business that's specifically mentioned in the order. So with restaurants, gymnasiums, and those things, if we need to make those regulatory, relax those rules, instead of relaxing the rule or trying to amend ordinance on the fly, we just ask that you consider giving the city manager authority to relax enforcement so that we can kind of turn a blind eye for the period here in the next 30 days so that we can accommodate our businesses so they can administer to our citizenry. The last thing that we would ask is, because the great state of Texas legislature has now imposed some responsibilities on us to respond to platting and other land use regulations, we would ask for authority not to accept any applications for zoning, plats, and other land use regulations for a 30-day period. By way of explanation, we're concerned that we'll have staff that become sick and unable to administer, or we start calling meetings just to handle these shot clock, what I call shot clock violations, from taking place and inadvertently approving something which should be given opportunity for our staff to professionally evaluate and make recommendations to this body to enact. So those will be additions to the prior orders that the mayor has taken care of in her declaration and the order. And so we would ask you to consider that, and I'd be happy to ask any questions. We'll leave the election stuff for a separate discussion, but those are the immediate things that we need to take care of tonight. Thank you.
Thank you very much, Mr. Hager. Questions or comments? Councilmember Yingling.
I don't want to speak too loud. Okay. Just so I'm clear, we talked about they changed earlier today about the 10. So the 50's out the door. It's all just 10 now. Is that correct, or am I understanding that?
The order that I have, it still keeps 50 for community gatherings outdoors. Recreational gatherings indoors, it's 10.
So recreational is indoor. So if there's outdoor recreation, there can be more than 10.
50, yes.
Okay, thank you.
Unless you decide otherwise.
Okay.
That's what's in the order.
The order says community, and then it says what is the it's something in recreational.
It called, yes, the recreational this open. It says community gatherings, clarification, likely to bring 50 or more persons together at the same time.
Okay, and then the 10 is the second one.
Recreational.
That's
gathering.
recreational or social.
Yes.
But you specified indoor. That's
It
what,
says.
I'm just making sure I understand it because I'm seeing
Community gathering is an indoor or outdoor event or convening subject to the exceptions or clarifications below that brings together, is likely to bring together 50 or more persons at the same time in a single room or in a single confined or enclosed space, such as an auditorium, theater, stadium, arena, or event center, meeting hall, conference center, large cafeteria, or other confined indoor or outdoor space.
So it's indoor and outdoor.
But it's an arena, it's the size of the facility. They don't have square footage, but this room would qualify for 50 or more.
Okay, so
The art center,
recreational.
recreational is an indoor or outdoor event or convening that is primarily social or recreational in nature, subject to the exceptions and clarifications below.
So the reason I ask, because I've been trying to get out and doing my walking, I see a bunch of kids playing basketball on the courts, and there's more than 10 of them. Is that considered a violation?
Yes.
Okay.
Yes.
Thank you.
Councilmember Roden.
Do you see any disparity between this ordinance that we're adopting locally or considering locally and what Judge Jenkins has promulgated for the county?
None other than the additional things that are local with regard to the shot clock, the things that we have jurisdiction over that they don't.
So if anything, ours is more restrictive.
In some respects, yes, because it touches on subjects that the county doesn't have jurisdiction over or govern. Yes.
It is not restrictive as far as the guidelines. What we have added in our resolution has to do with the operations of the city.
So it's more expansive, not more restrictive.
Correct.
So just for clarity, at any point going forward, we can either terminate this or extend it, correct?
Correct.
Correct.
Thank you.
Councilmember Mays.
I think the question may actually be for the mayor. One of the things I've been reading on the CDC website is I don't know that frustration is the right word to use, but they are a bit concerned that not all states, including Texas, are taking all of their recommendations. Did your phone calls that you've had address that topic?
Actually, we have been going pretty much with CDC, and there were consider that this is all of Dallas County. There were individuals on that call who would prefer that we didn't do some of the things that the CDC wanted to do. And Judge Jenkins was pretty firm that he wanted to stay with the CDC. And that was pretty much the general consensus of the group, that staying with the CDC guidelines was the best.
I know that the CDC was coming out with a 10-person recommendation early on, and that was one of their topics that was not being promulgated down. And it's good to see that the county is doing that now. So that's a very good
I
good
think
move.
Initially that conversation came about, and people were like, we're not going to tell people what they can do in their homes. But then people were not complying. I mean, they were general guidelines, and we were telling people not to, but people, and I can say this to add a little levity to the this, because this is very serious, but St. Patrick's Day, when all the bars were closed down, people still wanted to party, and they did. And so I think this is one of those things that just said, okay, if we're going to be serious about this, and if we are going to stop the spread, we need to make it part of the order.
Thank you. I have a question for Bob now. So I didn't hear you mention a date to end our proclamation. Is that?
What I have is I've done a motion for you all, and the declaration is it'll be your second meeting in April the 28th. And that, as it turns out, that's a really good day. That's about 45 days, which they say is from onset or exposure to watching this thing kind of curve out. It's a really great date for us, and we got lucky on that. So it's basically a 30-day extension.
And we can extend it from that point if we decide if we need to.
There's a public necessity to do so, yes, sir.
Thank you.
Any other questions? Councilmember Yingling?
For Mr. Hager, if we can extend it if we need to, but if we need to make it more strict as things come down, how do we handle that as a city council?
Well, I think that the mayor's got that authority under state law to issue a new order if need be. I've also added something to here as we've gone through and you've been asking questions to allow the mayor and the city manager to take reasonable and appropriate action to execute the emergency management plan as adopted under the city code of ordinances to protect the health, safety, and welfare, depending on what it is. If it's just a little tweak, an interpretive matter, we'll just take care of it by implementation of the policy through the management plan.
And then we would also bring it back to y'all for ratification. Thank you for the word ratification.
And one of the things, we're really close to shelter in place. And if there's another big change,
that's kind of why I'm asking.
I mean, we're down to 10 basically in day-to-day things, and so depending on how this kind of runs through our community, then we're awfully close now. So I don't anticipate anything from what I'm hearing, but that can change because of the way the virus acts.
Okay. A quick question for Chief Richardson. So, Chief, you said that we were at level 2. If we go to level 1, what does that mean? Would that be something we'd fall under in this situation? And if it is, what would that mean?
Okay. So a level 1 isn't determined, it's determined by need. So if it's determined that we need 24-hour staffing coverage, then that's what will determine whether we need to go.
So level 1 means going to 24 hours. Okay.
At the Emergency Operations Center.
Okay.
Right now, we have a staff at 12 hours.
Okay. So it's a timing thing. And then for Chief Barton, if we go to the shelter in place, what does that mean for us as a city, and how do we enforce that?
God.
Or is that something?
What this really means, you're supposed to stay at home, and then there's basically, depending on what the order says.
Okay.
Now, the only one that we've seen so far on a big scale is San Francisco. There's exceptions written in that to obviously go to the grocery store, to go out and walk your dog, to go to the pharmacy.
Okay.
So there'll probably be some exceptions. What we're trying to do is keep people from congregating in large groups. So as I seen San Francisco, there's people that are still out.
Okay.
Hopefully keeping separated, not in groups. So that's probably what it would look like.
Okay. Thank you.
Mm-hmm.
Councilmember Matthew.
Thank you, Mayor. I have a question for Chief Richardson. Dallas County identified 2 patients within Coppell residents infected with the virus. Did they use Coppell EMS service?
They did not.
Thank you. I have a question for Bob. Section 4, it says, any prior resolution of the City Council in conflict with the provisions. Can you give us an example of what is that, any prior resolution in conflict?
That is just a general repealer clause in case we've adopted some regulation out there somewhere that this will apply to this situation instead of some other random thing we did. It's just a thing that attorneys put in the resolutions to make sure that this resolution is in full effect.
Okay, thank you.
Any other questions? Councilmember Long. Can you walk up here to the...
Thank you. Okay, this is not a question. This is just basically a comment. We've got, and there's not anything necessarily that we can do about this directly, but indirectly we can be concerned about there is a parallel of catastrophes here running. One's health and one is economic. And there's nothing in here that we're covering, nor necessarily should we be, that relates to the economic side. But you should know that the Chamber of Commerce is working diligently with their membership and any other citizens that are interested in pushing them toward SBA loans and that sort of stuff, so that we can address indirectly through our chamber the needs that are going to exist, and they'll be rather acute as well, of our city businesses, and unfortunately their employee base. So there'll be folks that will be working on that side of the equation as well, and so I hope that, I know that we'll be working with them as well. So this is a direct situation. The other one's a more indirect situation, but that's ramping up as well for us to be aware of.
Thank you. So there are economic concerns as well, and there are banks, there are the chamber that, and there are a lot of different opportunities out there for people to find different options. We hear the president say a lot of things about what is going to be available, and he usually says those prior to the actual passing of any bipartisan law, and so as those things become available, I would direct people to their banks, to their chambers, to the SBA, and you will be able to find out what are the parameters where those things are available. That's a great point. Thank you very much. Any other questions or comments? Mayor Pro Tem Hill.
Thank you, Mayor. Bob, I wanted to ask you about item number 3C. The city shall suspend accepting any applications for zoning plats and other land use regulations. At this point, when we don't have any issues trying to process these, why would we not empower the city manager to suspend this when it becomes necessary?
Is your thing
I'm
on?
sorry, it's not
Thank
on.
you.
Because those require actions by the Planning and Zoning Commission and the council, those are really within your jurisdiction, and I don't know that Mike has that authority to do that, but you certainly do, to accept those applications. So that's why I'm asking you to do that instead of just leaving the manager, because we might get challenged in court, and the policy-making body of this city has made that decision for at least a 30-day period, instead of it being administrative.
I understand that.
Okay.
I'd like to add something about the business.
Mr. Land.
Yesterday, I believe it was yesterday, to Councilmember Long's point, Mindy sent out to our business community a link to disaster recovery funds. And so there are disaster assistance loans for small businesses through the SBA. They're specific. And so we, too, have provided that information to our business community to allow them an opportunity to make that application. So it's actually very important that if they think that that is something they may need, to just start that process.
It's very important because the process is not necessarily swift.
And it's not short. It's not.
And
it's not quick.
And it is paper intensive. Maybe. Any other questions about this resolution? Hearing none.
Mayor, I've got a motion that I would like for the council to consider. It'd be a motion to approve a resolution adopting, continuing, and renewing the mayoral declaration in order as amended on March 18th, 2020, and those are the changes that I read to you from Judge Jenkins, with additional provisions as set forth in the proposed resolution regarding FEMA, the manager's waiving of enforcement, the mayor and the city manager taking appropriate action to institute the emergency management plan, and the suspension of acceptance of land use regulations for a period until April 28th, 2020. Is that right?
Yes, 11:59.
At 11:59 p.m. unless sooner repealed or revoked, and authorizing the mayor to sign.
Councilmember Roden.
Move to approve the motion as read into the record by the city attorney.
Second by Councilmember Yingling. Any other comments? All in favor?
Long, Mays, Yingling, Hinojosa, Smith, Roden, Matthew, Hill. None opposed. Motion carries.
Thank you, Mayor and Council.
Thank you very much for all the assistance. Now, as an additional item that we need to discuss that has to do with the potential activity that may be affected by this particular outbreak.
See, look at
Crystal. Are you going to do it?
No, Crystal's going to handle it.
Talk with it? Okay. Mr. Land.
Just very, very quickly, I say quickly to introduce Crystal. Today, the Governor Abbott, I'm not sure if it's called an order or a proclamation, made a proclamation in which he gave the authority to city councils, local and school districts, local governmental entities, that if they have a May 2nd election scheduled, that they have the authority to move that election, specifically talking about the November election date for a uniform election date. The interesting thing about that is it doesn't say you have to move it. It says that you have to make a decision about whether or not to move the election. So some of the complicating issues related to this, and Chris will get more into this in just a second, is first of all, we've got a clock going now on the 60 days on the 50 or more. That's at the CDC level and the county level. So how do you hold an election? You saw yesterday that a state or two may have canceled their elections. Other states carried them on. You have a time period that the early voting starts April 20th and goes to the 28th for the election of the May 28th. That falls within that time period also. So you have that complication. You have a complication from the standpoint of Dallas County and Denton County, since we're a split city as far as our limits are concerned for Denton County and Dallas County. Dallas County, I guess all election offices have the option of not conducting an election in an even year. I don't know why that was written that way, but it was. So you have actually the election official has the authority to be able to say to their office, we're not going to conduct an election. We contract to have our elections serviced, if you will. We don't have the equipment or the manpower or the election judges or the training, those types of things. So we contract for those services through both Denton County and Dallas County. So now I'm going to turn it over to Crystal because she can kind of talk through how those conversations went today. What compounds this somewhat is that Denton County, while they said they want to have an answer by Friday, we are not asking for your decision tonight. We are giving you the information. It will be an agenda item on Tuesday night because this is something you do have to decide on. And so next Tuesday night during the council meeting, this will be an item for discussion and decision. So, Crystal, if I could just turn it over to you and talk about how things went this afternoon after about 3 o'clock.
Thank you. I reached out to both Denton and Dallas County. What Dallas County and Denton County are both speaking to is the fact that they are running into trouble with the gathering space, the numbers, the demographic of the typical election clerk and election judge also puts people at risk. Just the elements surrounding the declarations in the county and then trying to conduct a normal election. The concerns of whether people feel safe to come to the facility to cast the ballots. They are looking at various alternatives in order to still provide that service for us. It will come at a significant cost because you have the ability to split the cost with the counties, with the other entities. So the more entities that agree to postpone into November, then basically puts this as a sole source if we were to go that route. The other conversations were that we have approximately 450 registered voters in Denton County, and we have 27,000 plus registered voters in Dallas County. And so we would want to work with one specific entity to conduct one single election. And again, as Mr. Hunt spoke to, I haven't even had a chance to talk with the school about how the joint election, in a sense, could work. So a lot of this came as a surprise. A lot of my fellow clerks are all trying to inform their councils and figure out what the best method is. The concern in November is that you're up against a presidential, a state, a county, and a local ballot. It's long, and we haven't even thought about November just yet. So we have very rough numbers of just what we're looking at in conducting an election on our own right now. We're trying to ballpark that information. And then again, the responsibility to the community, to us, would be locating our own judges, locating our own, providing our own training for those clerks and those election judges, handling balloting, printing of ballots, and continuing to educate the public that whether the election chooses to continue and move forward in May, or again, educate them that we've postponed it to November. So in speaking with our city attorney, in the event we were to be able to conduct our own election, we would then seek to have it housed in one location here. What we're finding with early voting, vote centers, different things of that nature that play into it, we're having polling facilities that are canceling and not providing because the schools, which we use so often, are closed indefinitely in some areas. So that would be something that if we do conduct our own election, we would have it housed in one area for that period. That's what we're hoping for. Again, this is unprecedented.
As I said, and I know y'all are going to have some questions, but as I said, this is definitely something that will be on the agenda next Tuesday night for decision making. So this really did happen just this afternoon. She is just getting into the research, finding out what all's involved. Bob's getting involved in the conversation, this afternoon. So more. Crystal or Bob are more than happy. Notice how I've deflected. More than happy to answer any questions you have. But this is really one of those dynamic moments that this is the best available information we have.
No precedent.
Right. So anyway, so with that, Mayor.
So really, any question that you have may or may not be able to be answered at this particular moment. I can tell you that my first reaction was not only no, but bleep no. And because the ballot in November is going to be very, very long, and we as the local officials will be at the bottom of the ballot. So people will have to go to all the way through to the bottom of the ballot, and it will be pages and pages and pages. So my first reaction was we need to do whatever we can to make sure we do it. There are potentially other options to maybe postpone it. We don't know exactly what that means, but this is a very unusual situation that has unprecedented, says our city attorney, who has been doing this for how long? 41 years. So, questions, thoughts? Councilmember Yingling.
Thanks, Mayor. So if we don't have it in May, it doesn't mean we have to have it in November. We could do it on another date. Is that correct? No.
No. The idea is that we're postponing to a date certain, which would be November 3rd. There are
Okay.
only so many uniformed election dates per the election code, and so that would be the one that is recommended.
Okay. And a comment I have, the only, I have several concerns having it in May, only for the fact that we have our demographics of our clerks. We have a big community of people who I don't want to see not be able to come out and vote because they're worried about their health. But then also we have candidate forums that help educate our public on who the candidates are. And as that goes right now, who knows if that would happen or not. And a lot of people rely on those to make their decision. So knowing that we can't gather for big groups of people at this point, that would happen probably sometime in April. Most of them that happen in April. So that's one thing I worry about. We don't give our community the opportunity to see who the candidates are. So, just a
Councilmember
comment.
Roden.
Thank you, Mayor. My initial thought was like yours. I mean, as we look at our democracy, this is the kind of the bedrock of our democracy is being able to vote. I can only imagine if the governor or the president were to declare an emergency the week before an election and put it off, how we would all feel. And so I think there's a credibility issue there. I think what I would like to ask, and Crystal always does such a great job of with these elections, is to look at everything possible from a creative perspective to make this happen. I think candidate forums could be done via Skype. There's lots of different opportunities to do that. Even had somebody suggest to me today they're doing drive-up virus testing. Could you have people drop ballots off, in the parking lot, or is there an election law issue with that? I would just say that this is an important enough issue that we ought to do everything we can. I also have a concern about the partisanship or the partisan nature of the November elections, and the fact that ours have been separate in May have helped keep us from some of those issues. So to me, there's just lots of reasons to try to maintain it, other than we've got to maintain everyone's ability to stay healthy, and particularly for those who are most at risk. So I would just ask between now and Tuesday, I know that's not long, we look at every opportunity to try to maintain this day.
Councilmember Hinojosa Smith.
Thank you. Crystal, I actually needed just a clarifying question, or clarifying comment. You had commented about it could be, if it's on the even year, it could be moved to the following year. Is that an option?
No, there is a provision that offered counties to not have to administer elections on even-numbered years in May. So that is something that we've always, during several legislative sessions back when that passed, the municipal entities, really strongly requested our counties to continue assisting the schools, the water districts, the municipalities, because it is such, they do so much. They really do. They provide all of the equipment, the training. We provide the facility. It really is such an ease. But like I said, it's not unheard of. We conducted elections at one point in time before we went to joint contracts. So it can be done.
And I think just like Councilmember Roden, I would prefer that it not be in November, and like the mayor mentioned, it being at the very bottom of the ballot, and if it could be separate in some way, shape, or form. But I think, on Tuesday you can provide us more information, and you do a great job of providing a visual for us of just the pros and cons and the different options, and I think that's important for us to really think through and not rush and make the right decision for our community.
Councilmember Mays.
Thank you, Mayor. Crystal, when Governor Abbott first began talking about the ability for cities to cancel their elections, his first statement was he wasn't even sure he had the authority or the power to do that. And so he apparently went back and found out that, yes, in fact, he can. So my ask of you is, through your channels, inquire if we could find some exception to the Uniform Election Code and pick an election on another date under these extreme circumstances. Because I do agree that November is not a good date for us. We would like to have the election locally, but I also really don't want to see put our people at risk, either the workers or the citizens. So why don't you see if you can go through the back channels and determine if there's a possibility for doing that.
Absolutely. When we found this out, we reached out to not only just the counties, but directly to the Secretary of State's office. Of course, this was all responded to at the exact moment as soon as they issued the election advisory. Once upon a time, there were 4 uniformed election dates, but again, as a result of various legislative changes, they narrowed them down to basically May and November. Again, last legislative session, there was talk of whether they were trying to push all of the entities to the November ballot. So this is kind of something that is not necessarily unheard of because it simplifies the election process to that one date. But again, it didn't pass, so we still have that. The question is, I will look into it. I'm not certain because we don't necessarily fall under any vacancies, any special elections. This is just a general election, but I'll look into it.
Thank you.
Special, because it is a re-election. I mean, it is an abnormal circumstance. So let's say that it's a special one. Mayor Pro Tem Hill.
Thank you, Mayor. I have a question for Crystal. So, seeing that we have 3 candidates running for one position, good chances are there would not be a plurality. And if the election was held in November, what would be the runoff? Is there a certain date, or is that a special election that we can call at any point?
The election code speaks to the time frame following the canvassing. So just like May, while it does change a little bit from a calendar perspective, it looks like the runoff would typically be in December. So you would canvass, I think it's like 11 days or something approximately, after that November 3rd. And then you immediately have to call upon the canvassing and order the runoff. So it falls around, I want to say, usually that last week in November, first part of December. It's not ideal, similarly, where our runoff is typically slated for June.
Okay. And then one other question. What are the options for just a straight mail-in ballot for everybody?
So they did approach the mail-in ballot option, but they were speaking to that specifically to the primary runoff that is still scheduled for May 26th. That question was because I asked, since we haven't heard them rule on the primary runoff election, because that's designated by the parties, how they were going to handle that. Similarly, they talked about mailing all the registered voters a mail-in ballot and conducting it that way, but nothing has been decided as of yet. I can ask about that option. What they have put in writing and what the counties and the state have spoken to is about the extension, that if you had filed a year-long application for mail-in ballot, it would continue to the November election. They spoke about that if you were simply out of town as a result and had filed or requested a mail-in ballot, then you would have to reapply. But right now, all of the verbiage that has come out in the conversations we had really has been designed to helping the entities move to November. I have not heard as much questioning about staying. where it is. So I kind of feel like we're leading that effort, and I mean immediately phone calls, emails, we just inundated them with responses so that we could have as much information tonight as possible. But we'll find out more.
Any other questions, comments?
Mayor and Council, one of the things that Crystal is challenged with, and you've asked her to look at certain things, the Department of Justice has to approve any changes in the voting process, and that's under the Voting Rights Act. Even the machines have to be cleared for use, and that's why it's so important that we have to rely on the county making those available to us, and if they're accessible. So there's going to be challenges, just so you understand. We'll do whatever the council wants us to do and do the best we can, but there's things that are out of our control. Hopefully, maybe the Department of Justice will give us a directive that we can do something different because of the circumstances we find ourselves under. I don't know. So if we do hold an election and we don't get Justice Department clearance and it's something different than what we've done either under the election code or done before, we're going to run the risk of having the election invalidated, and then it's just a waste. So those, I want you to understand those challenges. We'll do our level best to give you as many options on Tuesday as possible. But those are things that Crystal can control, I can't control, the Secretary of State can't control. That's a Department of Justice oversight. So,
Councilmember Yingling.
So I'm not sure if this is for, I'm going to go to Crystal. Let's say we meet on Tuesday, and let's say we land on our original date of May the 2nd. So is what the governor said today, is that something that he can come back and just go, we're going to do it all here, or is that, because I didn't hear the conversation or okay.
Right.
So it's still very fluid and moving. Okay.
The proclamation that was submitted today just basically gave the entities the right to choose to do something different as a result of the emergency declarations in the state.
But then he can turn around and change that if he chose that he wanted to do that, because the situation changes.
I mean, I suppose what we're under as of right now, I mean, the only thing would be suddenly if this were all to go away and there was no longer a pandemic, because basically the way the calendar is working, we're all under this deadline, which is why they are wanting some general direction as of Friday, is that we have notices to post by April 2nd that state every polling facility and meets the criteria of the law as it is today.
Gotcha.
Well, right now, half of those polling facilities are no longer in existence because everybody has canceled indefinitely due to closures. So I already have to amend that, and then we're trying to assemble how we're moving forward. So that's kind of why we're trying to see that if we do, then we are removing ourselves from a joint contract and then really just looking for the equipment and the partnership to be able to conduct our own simplified election. And whether the school chooses to join or however that works out, it's an isolated, conducted election.
Thank you.
Councilmember Roden.
Not a question, just a comment. In the midst of all this challenging news, it was gratifying today to see in the governor's announcement his reaffirmation for his affinity for local decision making. I thought that was positive.
Puts a smile on everybody's face that is in local service. Okay. Is there any other business to come before us regarding this particular item? Hearing none. The time is 8:06 and we are adjourned.